for joining this webinar. This is a very important webinar. I also want to thank you for the work you are doing. I know we are in a very difficult moment managing this crisis, as well as ensuring that our work continues to save the lives of women and adolescents and youth. So thank you so much for the perseverance, the resilience, and your business continuity. I think this webinar is actually another sign that we are ready to continue with our business, although we are managing in a different way. Now, for example, we are working from home, but we are adapting and adjusting to make sure that the work continues while adapting. Let me welcome our colleagues, our partners, the scientists who actually were behind developing this tool. So I want to thank you so much for the excellent work. We have John, Richard, Nadia from Avenir. We have Victoria from Johns Hopkins University, John and Bruce from Victoria University. These are our partners that did a tremendous job. So thank you so much, and you're welcome to UNFPA. We hope to see you many more times, because when you come, we know good things happen. So thank you so much. I know that later on you'll be introduced more fully in your respective positions. So colleagues, again, I think I don't have much to say apart from saying that this is a very, very important webinar, because as I mentioned before, the work of achieving our ambition of the 3 transformative results continues, and indeed must continue. We know we are doing it differently now under the circumstances, but continuing it must. And I think it is important that we give you all the tools that you need to continue taking this work forward. The Impact40 model is one of those tools that we think will be very crucial and helpful. I hope you also find it helpful, and I hope you'll find this webinar very helpful. So thank you. Let me also thank my colleagues, Taranga and Howard. I know they have been working tirelessly, so thank you so much. Without much further ado, again, thank you so much for joining in, and I hope you enjoy and really learn a lot, and go ahead to use this tool that we are covering in this webinar. Thank you so much, and over to you, Taranga and Howard.
Thank you very much, Charles, and thank you, colleagues, again joining. So maybe first of all, I would like to give a little bit introduction about the tool, and then why we developed this tool. And Charles briefly mentioned about the most important elements of it. But just to highlight you a couple of points, then I will pass the floor to Howard, my colleague Howard, and Howard will introduce the scientist behind this, developing this tool, and they are ready today to present each and every module in the tool. And then at the end, we have a question and Q&A sessions. We have more, actually this is a 2-hour webinar, so we have more time for asking questions. I'm sure you have a lot of questions around this, so we can discuss since the presenters are here today in the webinar. So that is the flow, and maybe just to start and about the tool. So first of all, we call our tool Impact40 or Impact40. So you know why the 0 comes, because we are aiming at achieving this or ending this 3 transformative results, so achieving these transformative results by 2030. So as Charles said, it's our duty, or it's our role to give you or equip you with correct tools and guidance to go for that vision. So this is just one of the milestone of that journey from Policy and Strategy Division. So Impact40, I think I'm not wrong if I introduce this as the first impact system in UNFPA. And that is the most interesting and exciting moment. And on the other hand, I mean, we have been waiting for nearly 1.5 years to have this system ready. So thanks to all our partners. So now we have this system for piloting. Into 2021, we are considering as a pilot year for the toolkit. So, so you see some of the modules we can further improve, but it may need some time and some of the, your comments. So therefore, 2021, this year, sorry, 2020, we are considering as a pilot year. And as Charles mentioned, the tool was developed by Avenir Health. So they are here today, and with the, in collaboration with Johns Hopkins University, Victoria University, and of course, our inputs from our colleagues in UNFPA. So, that's all about the tool. And the tool is available online. And if you go to impact40.org, you can easily, locate the tool. And it's already available for public, even though we are thinking about releasing this tool to public by end of this year or early next year. So, but we thought from the beginning, we should make it available as a tool. So anyone can go, our partners, UNFPA staff, our partners can go to impact40.org and access the tool. So that's all about the tool. I hope you have a basic understanding about, about the tool. So let me go to the next point about, I mean, Charles also briefly mentioned why, what is the rationale behind developing this tool. So, I mean, Charles also mentioned, now we have this 3 transformative results to be achieved by 2030. So, and these transformative results in a way demonstrate our commitment to achieve the Sustainable Development Goal and ICPD Program of Action. So this, I mean, I always like to start the session with this diagram because this tells you how these 3 transformative results are aligned with the Sustainable Development Goals. So on the other hand, applying this tool, we are trying to accelerate the implementation of the 3 transformative results. On the other hand, we are really accelerating the achievement of the Sustainable Development Goal. So we should not just think about it's only 3 transformative results context, but it's actually much beyond that. It has some enabling effect of achieving ICPD Program of Action and the Sustainable Development Goal. So I remember colleagues who have joined our previous webinar on the toolkit for investment cases. You have seen this slide. So we have, we really want to accelerate now. This is the time for accelerating the achievement of the transformative. So this tool has a powerful effect on accelerating. So what acceleration means? So UNFP, we are thinking like a 4-dimension of acceleration. I mean, we have to go business, there's no sort of business as usual, and we all need to make a sense of urgency to our work, and we need to promote partnership and going with more joint accountability, and we really want to learn and adapt ourselves. So those are more or less like a 4-dimension of the accelerations. So then the immediate questions coming to you is, okay, in order to have these 4 elements operationalized, what are the things we should have it? So that's the purpose of introducing the tool, because these Impact40 tools give you the impact and cost of the 3 transformative results. So I think in order to accelerate, impact and cost is playing a critical role. Without knowing that, it might be very difficult for us to go to the acceleration mood. So that's the purpose of introducing Impact40. And I hope that really play that role in the critical manner. So now let me quickly navigate, just go to the tool and give you like a very basic overview about how the tool looks like. Then I will pass the floor to our presenters, and they will give you more information about the tool. So again, the tool, the primary purpose of Impact40 is to give you estimate the impact and cost of achieving transformative results. Why? Because having impact and cost is really important to accelerate the achievement of the transformative results. So I hope you all have seen the tool. So I'm not going to the online version, and I have actually kind request also. We want you to not to go to the live tool at this moment, because if everyone goes to the tool, there will be some delay in loading, and so therefore, I mean, maybe after the webinar you can just go and check it. So basically, this is the structure of the Impact40 tool. You see there's very easy 4-step process. And the step 1 is before using the tool, we want you to really know what is this tool is about and the steps behind it and what are the steps we need to follow to utilize the tool. So that is the learn about the tool. And then step 2 is giving you these our basic 3 transformative results, some sort of a filtering option or selection option. And that's the step 2. I mean, it's very easy. I mean, you can see just a 4-step process. And step 3 will help you to estimate the impact for each transformative result. So because when you select each transformative result, you see the relevant impact estimating model is appearing. So that would really help you to calculate the impact. And then the 4th step is, we can call it optional step. So because we know that all of you might not estimate the cost. You might, some of you might stop at the estimating the impact of the 3 transformative results. So, but if you think I need to, or we need to estimate the cost, so you can go to the 4th step, which is estimating the cost of 3 transformative results. So that is the 4th step. Again, you see when you select the transformative results, you see the corresponding model you can use to estimate the cost. So it's very simple 4-step process. And I hope it's convenient for you to navigate and use in an effective manner. But in addition, we are thinking about giving you some support, some sort of instruction, some support in utilizing this tool. So there will be, if you look at the menu, there will be a question and answers, a frequently asked questions session. I mean, you don't see it right now, but after this session, we are gonna fill that session. And then there's a section called about the tool, and there are resource section. And you might get a lot of, not a lot of, some of the work we have been doing on this area, like you have seen the global cost estimate for achieving the 3 transformative results. And I'm sure you all have seen the toolkit we just developed to implement the investment cases for transformative results. And there are other papers also around that has some good information for you to read. And then the most interesting, there's a help section. So you can just click the help and it's coming to the secretariat if you have any questions, then we can help you on that. But in addition, I just want to tell you, we introduced this impact40@unfpa.org email. So anytime you can just write to us if you're stuck, if you need more information, and we are trying our best to help you with the required guidance and support. So this is very basic, and this is the overview of the Impact40 model. Maybe I will stop there. Then I want to give the floor to Howard to introduce our presenters, and then go to the detail inside of each module. Howard, over to you.
Thank you very much. Good morning, good afternoon, and good evening. It's a pleasure to have so many people online. We are over 200 participants, and they keep joining. So what I'd like to do is maybe first start by giving a little context about where we're going to go this morning. We have a number of our scientific research partners from Avenir Health, Johns Hopkins University, and Victoria University online. We're going to systematically have them walk through an introduction for each respective part of the tool, giving an overview of how to estimate impact and costs. We're going to go through that step by step, and then we're going to leave about 25 to 30 minutes at the end for questions. So for those of you who have questions, I'd say, well, first, you're doing a great job of keeping yourself on mute, so please keep doing that. But send your questions directly to the chat box, and at the end, we will have the opportunity to go through them. So that's the overall process. Another thing to emphasize is this is a learning phase, and what that means is we will continue to refine and enhance the tool as we understand feedback from pilot countries this year and our own experiences. So let's please approach it with that idea that we're going to learn really as a community on this. So with that said, our first presenter is going to be Victoria Zhao. And quick background, Professor Zhao is a faculty member in the Department of International Health at Johns Hopkins University's Bloomberg School of Public Health. She's collaborated with many different research organizations, including the Gates Foundation, USAID, JPIGO, and is an expert in the application of LIST, the LiveSave tool. It's important to note that she's been a critical partner in a lot of the research efforts that we've had over the last few years, and we certainly welcome her to this session. She has a master's in biochemistry and molecular biology and a PhD in international health. So Professor Zhao, over to you.
Good morning, good afternoon, good day to you all. I'm going to go a little bit quickly, but guide you to some additional resources that are also available because the advantages for a lot of the work that UNFPA has led in this area is we've been able to piggyback on the other work that we do with the main structure of the LiveSave tool. So just sort of starting with the model, as Tranga outlined, the four, let me move this one out of the way, the four steps of the process when we select ending preventable maternal deaths, which obviously is a priority for many of the programs that are being developed. The option to estimate impact is based upon the LiveSave tool impact model. So that's going to be LIST. Let me briefly, I just wanted to highlight, for most folks I know, at least they've heard of the LiveSave tool. It's an integrated platform that allows folks to estimate the impact of interventions, which are specifically looking at, broken out into sort of a continuum of care. Key interventions based upon the evidence base and their effectiveness for reducing specific causes of death. And so in particular, the ones that we are most interested in, for example, are key causes for ending preventable maternal deaths. What we're going to be focusing on are interventions that are addressing the key things like postpartum hemorrhage, antepartum hemorrhage, hypertensive disorders, et cetera. So we are looking upstream at scaling up these interventions to reduce mortality. The other way that we had collated the list of interventions that we would be including in the model for UNFPA is they're both interventions that are important or would reduce maternal deaths, but more importantly, there were also interventions that are important for maternal health. So in other words, interventions delivered at or around the time of pregnancy, which in particular are going to have a benefit for either reducing stillbirths, improving birth outcomes, for example, but they may not be directly related to a maternal cause of death. So when we go back to the UNFPA's impact model based upon the LiveSave tool work, the first step what you're going to do, and I've already populated, but the first step what you're going to do is you're going to select, you're going to see this is blank, and it's going to have a dashboard that has those key 27 interventions that we have itemized. So the 27 interventions, as I mentioned, are key, and I just reset it, sorry, are key interventions that reduce either maternal deaths or are important for maternal health overall, for example, prenatal or antenatal care. So when we look at these interventions, they're organized here, as I mentioned, by the continuum of care. The 27 interventions are broken out. Currently, the dashboard has no coverage because there is an underlying database that pulls in coverage of key interventions from either the last population-based household survey, a DHS or a mix, or alternative or different proxy measures for estimating coverage of these key interventions. So for example, if I select one of the countries that anticipate doing an investment case, if I select Kenya, for example, what will happen is the website here is contacting, uploading the data from the database so that these values that we have collated by standard definitions are included. And so, for example, if I wanted to highlight two key interventions, for example, so this is saying that, you know, the coverage, the 0 to 100% coverage of an intervention, for example, tetanus toxoid given during pregnancy, so a woman who receives 2 doses or more, is based upon the last survey about 35%. And for other interventions, they're listed for where the starting baseline coverage is. The interventions are going to be scaled up. So in other words, when we're doing program planning and we're saying, okay, if it's currently at 100, it's currently at 88, my goal is to scale this coverage up to 100. So I would just enter a value of 100, interpolate, which produces a smooth trend. And I'm just going to pick one other additional intervention of clean birth care or clean birth environment. And the idea is that for programs that are designing a package or a platform, once you select view results, so right now sort of the analysis has been populated with the default data. I've selected the key interventions I'm interested in. I've scaled up to the level, and again, for the purposes of illustration, I just did it to 100, but we've set it to a target. At the bottom, the results which are populated are the number of maternal deaths. So obviously when we note the impact of a clean birth environment is significantly going to contribute more to reduce maternal mortality than introducing or scaling up or improving coverage from the 88% baseline of TT. So part of one of the challenges has been prioritizing interventions to be able, I was going to highlight this, to be able to determine which inputs are going to have the anticipated outputs. And so in the last sort of minute, I just wanted to highlight. So for example, one of the benefits would be that for TT, it's going to have an impact to reduce neonatal mortality as well as maternal mortality due to indirect causes. But if, for example, I was to look at clean birth, that would have an impact on maternal as well as neonatal deaths. So in the dashboard here, what we're representing is the reduction in the maternal deaths. So the maternal deaths prevented over the time period and including the target year. So I'm just going to X this out so that I can highlight sort of the next step. So the 2 components, one being impact, the other being cost. For estimating costs, we're recommending that users would be able to download and use the Live Save tool where there is a costing module that's associated. The current dashboard allows you to look at the impact of those interventions. In other words, scaling up these key interventions to certain target levels would have what anticipated benefit to reduce preventable maternal deaths. The impact is obviously linked to associated costs. So in other words, scaling up those services to the levels we would be able to estimate costs with the Live Save tool. So that I won't be covering in the demonstration today, but the online platform allows planners to be able to run different scenarios to compare and evaluate different impact scenarios. So I am going to pass it over and answer questions at the end. I'll feel free I'll monitor the chat and I'll make sure I respond to questions at the end. But thank you, Howard.
All right, thank you for that terrific introduction. And let's keep having those questions come over the chat box. So I think we're doing great so far. The next presenter I'm going to introduce is John Stover. John is the founder of Avenir Health, and he was Avenir Health's first president. He currently serves as vice president. John was a vice president at Futures Group in the Center for Economics and Modeling. He has decades of experience in examining population and health issues, and he's truly one of the world leaders in this space. It's a pleasure to have him, and I know John is going to be presenting. He's also brought some of the other team members from Avenir Health with him, so in case there's other questions that go beyond the specifics of what John's presenting, we have other team members as well, and we're actually asking John to do a little bit of double duty here. So John, you're going to start by presenting some of the family planning, and then afterwards, appreciate if you can present the gender-based violence as well. Over to you, John. Thank you.
Great, thank you, Howard. Yeah, so I'm going to talk right now about ending unmet need for family planning. So under step 2, as you were seeing from Victoria's presentation, we're just going to select ending unmet need for family planning. And now the estimate impact and the estimate cost sections change to show you the links for the family planning module. So if I click on the estimate for impacts, I'm going to have another screen, somewhat like Victoria showed. I have the option here to pick whatever country I want to work with. So I'm going to choose Mali here. And as soon as I choose that, it's communicating with the server to download the data that we have available from Mali. Unlike the list application Victoria showed you, here the inputs are set up automatically. So one option here is to automatically calculate the modern contraceptive prevalence rate required to, quote unquote, end unmet need by 2030. And just to show you what that looks like is that for these transformative results, we've defined, okay, what's happened to my, well, let's use it this way. Ending unmet need by 2030 is defined as increasing modern contraceptive prevalence from its current level to the level of contraceptive prevalence plus unmet need plus traditional use. So for Mali in 2019, modern contraception is about 16%. There's about 1% traditional use and 24% unmet need. So the goal by 2030 is to continue that modern contraceptive use and convert traditional use and unmet need to modern use. So the goal would be to increase modern CPR from 16 to 41% by 2030. So this goal is automatically built in to the model if you use the radio button that there says automatically calculate MCPR. You have the option of entering your own CPR, and if you do that, then you'll get a box that'll ask you to enter the modern contraceptive prevalence rate in 2030. But for this illustration, let's stick with the automatic calculation. And then when I click, once I've set that, I can click View Results. Again, it will communicate with the server, asking the server to do the calculations based on those assumptions that I've set. And then the results come back to me here, and I can see the main impact indicators that we're using. So this is the number of unintended pregnancies averted due to modern contraceptive use. So remember, with 23% unmet need for family planning, there will be a lot of unintended pregnancies. Some of those will be averted as we increase MCPR, and that's what you can see in the first row. The second row is the number of maternal deaths averted, which is largely coming because of fewer births. And then the last row is the number of unsafe abortions averted. And this is coming from an assumption, data for each country about the proportion of unintended pregnancies that are aborted. And so the model is calculating both intended pregnancies and unintended pregnancies. The number of unintended pregnancies is going down as we reduce unmet need. So the number of abortions is going down, so we're averting abortion. So you can see the pattern here of increasing number of unintended pregnancies averted, maternal deaths averted, and unsafe abortions averted. So those are the main impacts. And then I can also estimate the cost. So if I click on this one, you'll see now, using the same assumptions for Mali, the estimated number of modern method users, shown here in the first row, and then the estimated cost. And in this case, the cost is coming from information collected by Track 20 and the FP 2020 program about current family planning expenditures. So we've taken the best estimate of current expenditures of family planning in Mali, divided it by modern method users to get a cost per modern method user, and then applied that in the future. So that's what's giving us. So we're seeing here that the cost would increase from about 18 million to about 64 million by 2030 in order to meet those goals. So this is what this tool does for you. Now there's a lot more going on behind that in the FamPlan model. And if you're interested, you can download Spectrum and actually run this in Spectrum. you'll get the same results, but then you'll have more flexibility to change input assumptions and to see all of the different assumptions and results that are in there. But that's all happening behind the scenes when you use this tool. So it's designed to give you a quick way to replicate the calculations that we've done for ending unmet need for family planning. I'll stop there. Thank you very much.
Okay. Thank you very much. I appreciate that, John. And that gives an overview of the family planning module. I know that we're going to first pause. I want to take a commercial break. When I say commercial break, I'm not actually going to turn off the video, but I want to thank the researchers, because I don't know if folks have been reading what's going on in the social media and on the news, but over the last day or so, UNFPA is dominating the news with their calculations of what is the impact of COVID-19 on the cost and the achievement of 3 transformative results. So there's a lot of strong articles out there, The Guardian, Twitter, all covering this. And it's a strong collaboration between UNFPA and the researchers online right now, Avenir Health, Johns Hopkins University, Victoria University. So thank you so much for that. We're gonna continue in exploring the tool, Impact40, and I'm gonna ask John to come back and help us out as he introduces the gender-based violence module, giving us an overview of how it computes impacts and costs. So I'm gonna pull you right back, John, and thank you so much.
Okay, thank you, Howard. So now if we're going to move to, in step 2, we move to the ending gender-based violence and harmful practices. And now we've got 3 options down here under estimate impact. So if we pick the use gender-based violence impact model, then we get this screen for gender-based violence. And again, we can pick our country from the drop-down list. This time I'm going to pick Cambodia. And then you can see here the key interventions that have been included in the estimating of impact and cost. Right now, we don't have any coverage targets set in 2030. Oh, sorry, I do have 80% set here for each one of these. So community mobilization, outreach to male youth, economic empowerment, outreach to female sex workers, and mass media are all interventions that are designed to prevent gender-based violence. So
John,
here,
you're not showing your
John,
screen.
can you share your screen, please?
sorry, you're not seeing my screen.
Thank you, John. And do you mind stepping back maybe 1 minute in your presentation, just so people can see where you were coming from there? Thank you again.
Okay, sorry. So here we're selecting the gender-based violence module and then selecting our country from the drop-down list. Then we see the list of interventions. These first 5, as I mentioned, are designed to environment to prevent instances of intimate partner violence. And then we have counseling, which is designed primarily for treating victims of gender-based violence, and then treatment, primarily targeted to treatment post-rape. So if you have data on the current coverage of these interventions, you can include that here. And then 2030 is where you put in your target coverage. So for the global costing, we use 80% as our target for full coverage. Then down here, you're going to see our best estimate, usually based on surveys, of the current incidence of intimate partner violence, a percentage of women that report at least one instance of intimate partner violence in the last year. And then this box over here is our estimate of impact. So there's a little information box here that will explain this to you in more detail, and it's also in the manual. But this comes from, this is the median impact from about 17 different studies that have looked at the impact of different interventions to prevent gender-based violence. It's a little tricky to do this because each of these studies measures it a little bit differently. The interventions are all a little bit different. So we've tried to review all of these studies and come up with our best single estimate of how implementing these different interventions would reduce the experience of intimate partner violence. You could change that number if you'd like to experiment around with sensitivity, but we don't really urge you to do that unless you have some particular expertise. So then once you've set the coverage, then you can update the results and look at the impact. And the main indicators we have here are the percentage of women experiencing intimate partner violence in the last year, the number experiencing it, the cases of IPV averted, and the cumulative cases averted. So you can see that we started off here in Cambodia with about 11% experiencing violence in the last year, and through implementing these interventions, we've brought that down by about half and averted 1.2 million cases of intimate partner violence. And then there's also a cost component for GBV. And if you click on that, what it will do is download for you a spreadsheet that you can see here that allows you to look at the costs. Again, the spreadsheet has a drop-down menu, you can pick the countries. You can set your target coverages. This will show you the assumptions that we've been using in the global analysis for the costs for implementing each of these programs in each country. Now, we don't have, obviously, detailed studies of the cost of each program in every country. So we've taken the best studies we can find that costed these programs in some country, and then we've adjusted the unit cost for purchasing power parity to give an estimate of what it would be in Cambodia. Clearly, if you have better information, you can replace it. Anything that's in yellow here is something where the user can change numbers. And then you'll see the full results over here. So this is the cost per year by intervention, and you can see the estimated total cost here and sort of the allocation of costs. So that's the information that's available on costing GBV. And as the other speakers have mentioned, this tool is designed to get you started, to make it easy for you to make initial estimates. If you want more detail and get into more detailed planning, we're ready and willing to help you. Thank you.
Thank you very much, John. I think that's excellent. And there's a theme in here that I think will continue to be repeated, and I see it in the question and answers as well, which is the value of these tools is that it gives you a starting point as a country, but the expectation is that you're going to review inputs yourselves and modify them when appropriate, modifying whether it's baseline values, whether it's unit costs. So I think as we continue to see and flesh out some of the other components we have here, you'll continue to want to think for yourself, as I try to tailor this for my country, what information can I use based on international estimates, and what information do I need to incorporate based on local data? That said, we're going to continue to do our survey through the tools, continue to send in those questions. You'll notice sometimes answers are already being posted in the chat box, but we are going to systematically go through as many questions as possible afterwards. So please continue to do that. As we move through this process, the next section we're going to look at is the models related to female genital mutilation. The presenter for that will be Rachel Sanders. Rachel's a senior policy analyst with Avenir Health, and she's been coordinating much of the work on the One Health tool. So she has deep expertise in not only the One Health tool and list, but many other pieces of software. She has been leading many of the analytic processes throughout this work stream, and before joining Avenir Health had been at IPPF. I should note that the FGM work is continuing to progress and generate insights, and at the same time, we have drafted a research paper really summarizing that for a peer review audience. So with that, I'd like to hand it over to Rachel, and if you can present and walk us through the FGM module, that would be terrific. Thank you so much.
Okay, thank you, Howard. I'm going to share my screen. Please let me know when it shows up.
I see it now. Thank you.
Great. Thanks so much. All right. So much like the others, I just want to highlight that the first step is really to select the transformative result where you want to be working. So in this case, you'll find the information about FGM under the gender-based violence and harmful practices result. Once you've selected that option, you'll see that you have a couple different components from which you can select. If you're very much focused on just analyzing the impact of the programs that you might scale up, you can select the impact estimation tool, which is right here. And if you want to also incorporate costing of what scaling up a package of services might look like, you have that option here under estimate the cost. So I've got both of those spreadsheets open on my computer, and I'll be showing that now. So the first one is to look just at the impact analysis. Your option is to select the country at the top of the spreadsheet. You can see that we've analyzed a number of different countries where there's a high burden of FGM. You can see the list here. I'm going to be showing an example from Mali today, but we've preloaded the software with DHS and mix analysis from all the countries that you see here in green, and we've provided an opportunity to do analysis using proxy countries for those countries that are highlighted in blue. So with no further ado, let me just show you the impact analysis option. You select your country from the top of the tool. It's quite simple. You'll see the changes as you do that. What this has done is linked up the analysis of the program scale up to an underlying database that looks at populations, history of FGM prevention programs in a country, and the subsequent trends that are being seen in terms of prevalence and incidence, and then allows you to overlay a targeted prevention program on top of the structural change that we've seen already underway. So we've made this quite simple. Really, all that we ask the user to do is set a target for direct program interventions, and then to also make an assumption about the number of communities that will be impacted indirectly by each community that are reached by your prevention programs. So
Rachel?
Yeah.
Rachel, can you get perhaps a little closer to the mic? You're drifting in and out a little bit.
Sure.
Thank you so much.
Telling me. And I'm also going to check the setting to make sure that my microphone is on. Is that any better?
You're just drifting in and out a little bit. So if you can just stay close to the mic, that would be great. And if everyone else could just stay on mute. Thank you.
Okay. Thank you for telling me. So the assumption for the global analysis that we did is that at an ambitious scale-up pattern, we would reach 25% of communities with majority approval of FGM with direct prevention programming, and that an additional 3 communities would be reached or sensitized indirectly for each community that you are implementing the community empowerment programs. And so that's what you'll see when you open up the tool that we've provided on the website. However, if on the other hand, you feel that that's an overly ambitious target, or you want to do some sensitivity analysis around those assumptions for a specific country, you're able to adjust those targets and see changes accordingly for prevalence in both the youngest and more broad age groups, as well as cumulative cases of FGM averted. And we've got tables to the right that show you each of those items in a numeric format that can be copied and pasted into any reports that are being developed. The calculation is automatic, so when you make changes to your targets or your impact analysis, you'll see those changes happening accordingly. So for those, as Howard said, there's been a report written about the methodology that underlies this analysis, and we are submitting it for peer review. So and we're also happy to answer any questions if people want to talk a bit more about the assumptions behind the analysis. Now, as I mentioned, we were lucky that there's 22 countries that had a quite in-depth DHS module on FGM, but there's an additional 9 where we know there's quite a heavy burden, but that we don't have as much information available. So you'll see in the drop-down list that the top set of countries are those for which we have DHS or mixed modules, but there's an additional set below. So my initial demo was on Mali, but if we also think about other countries that don't have the quite as much information, we've included them at the bottom of the list. We perform the same type of analysis, but we ask that the user select a proxy country, which will give information about the time trends and other background data that is not available for the country of interest. So for example, in this option, I selected Eritrea, where we know there's a good deal of FGM, but we don't have as much information about recent incidence trends. And so we select a proxy based on what we know about the dynamics of FGM in the country. So drivers, past programming, etc. So in this case, I selected Ethiopia as an example for a proxy. And you can see that there's drop-down menus that allow you to select each of the selections. So this is the impact sheet. If you are also going to be analyzing the cost, you'll see that it's a very similar spreadsheet. I've got Mali selected right now. You're making a similar set of selections around target coverage and communities impacted indirectly, but an additional number of cells are now highlighted in green, including baseline and target coverage for a broader set of programs. So the impact analysis primarily focuses around community empowerment programs. So you would set the baseline coverage for that, and then the target coverage is being drawn from your selection up here. Unit costs are provided based on the analysis that we did at the global level, where we looked at as many countries where we had information about implementation as possible and then adjusted them using GDP ratios. These can all be edited by the user if you have better information. So again, let me just remind everybody that baseline and target coverage and unit costs are the additional items that would be required for the cost analysis, as well as a few parameters around the existence of legislation, proportion of FGM, which is type 3, overhead costs, and materials development costs. Once these items are filled in, you'll still have the estimates of prevalence among different age groups, cumulative cases of FGM averted, but you have an additional tab in the cost spreadsheet, which gives you cost results by year and combines them with impact results in order to give you a cases of FGM averted and a cost per case averted. So we found that these are typically the results that teams hope to find for their country analysis, but we're, as the Runga said, we're very much looking forward to feedback from the group as you start to use these tools, and we're excited to see how they're implemented for individual countries. Thank you.
Thank you very much. I see that the Q&A section continues to be fast and furious. So for folks who are looking back and forth, you can see the presentations. You can also see a lot of responses being provided. And we will have a lot of time at the end to address them. We're documenting the questions on the side. I appreciate that we've been going through this fairly quickly. A lot of people are asking, well, how do I get more information? And towards the end, Nadia is going to connect these presentations with the written toolkit that already exists. But it's also important to note that many of these tools already have detailed user guidelines and guidance notes. And so all that information exists and the linkages are available online, and we'll make sure that you see exactly where you can get that information. Also, as Taranga indicated at the beginning, we do have a help desk that's set up, and our goal is to really make sure that we have successful use of the work. With that, we're actually going to transition to the next model, which is about child marriage. We have troubled our good friends from Australia to stay up very late for us, so we thank very much. We have Professor Bruce Rasmussen and Professor John Simons on. Bruce has been working in many different areas. He's the director of the Victoria Institute of Strategic and Economic Studies. He has covered a number of different areas in his research, focused primarily on improving health and well-being, climate change, energy use, and inequality. In addition to a lot of the work that he's done for UNFPA, his work looking at the economic returns on investment has been a focus for the World Health Organization, UNICEF, the U.S. Chamber of Commerce, APEC, and a number of other institutes. John Simons is an environmental economist who has worked in a number of different areas. His PhD looks at the business case for voluntary emissions reduction. He has a specialty in mathematical modeling. And in addition, he's a research fellow in the Victorian Institute for Strategic Economic Studies. So with that, I'll pass it over to Bruce and John, and please lead us through. Thank you.
Thank you very much, Howard, and greetings to everybody, if whatever time zone you happen to be in. I'm going to start the presentation and present just a couple of slides, and then I'm going to hand the more difficult issues over to John, who can explain the model. Now let me see if I can get my screen up. Can people see that screen?
Not yet, but hopefully soon.
Well, let me have another go at it then.
John, you want to try steering the ship? See if you can take over?
Bruce has got some slides which I don't have, so I'm just waiting for, I was going to talk about the model particularly. Bruce was going to talk about the background and the context.
Okay, I'll talk to it. Our model uses a theory of change for child marriage, which looks at two components. The first component is a set of interventions which directly address child marriage. So these are things like life skills programs, community mobilization programs. There's a second set of
I'm sharing my screen now, Bruce.
What's that, sorry?
I'm sharing my screen, so people hopefully can follow along.
Okay. Yeah, I just don't know why my screen is not coming up, but anyway. So the second part of the model looks at interventions which increase education. So education is a major, increasing education is a major way of reducing child marriage. And so we look at a series of interventions which make schools more girl-friendly, improve the quality of teaching, provide economic incentives for girls to attend school. So you'll see those when John gets into the model. The second thing I just wanted to mention was that, a bit like the Rachel's model, we've looked at historically the rates of change of child marriage historically, and about a third of the countries are declining, have declining marriage rates, and we are looking at the additional intensity of the interventions for those countries. So we assume that the current trends will continue, and we're looking at costing the additional interventions. There are other countries which are where child marriage rates haven't changed much, and where the interventions that we're modelling have to achieve all the reduction down to about, not assuming that we'll be able to eliminate child marriage by 2030, but say to levels of about 5%. The last point I just want to make, which John will demonstrate, is this is a cost minimization model. So it takes, looks at the interventions which we have in the package, and it selects those that will achieve the greatest reduction in child marriage rates for the least cost. At that point, John, I'll hand over to a more competent technology person.
All right. Thanks, Bruce. Can I share my screen now, Howard?
Yes, please do.
I'm going to just bring up the model. So you can download, you should be able to download this model through that Impact40 page. Please don't do it now, because if everyone downloads it, I think it'll be a bit slow. But then when it opens up, you'll come to this page, and it's a merely a case of filling in the the sections that are appropriate to you or your particular country. So, for example, we can choose a country here, then we can choose whether you can look at the total, or you can also look at just in urban areas or rural areas. And these are the interventions that we have modelled, and the costs are automatically adjusted to each individual country on a per capita or GDP per capita basis, and they have relative effectiveness in reducing child marriage. As Bruce was explaining, some are specifically aimed at child marriage interventions and some are related to education interventions. And in addition, we've modelled it as a target of 5% child marriage by 2030, but that can be changed also. You can change that target. You can also change the start year of interventions and also the full year of implementation, because it is assumed that the interventions are ramped up over time, but you can change at what rate they are implemented. And as Bruce was explaining before, we've incorporated the existing trends of child marriage for each of the countries we've looked at. So for some countries, the trend is already quite substantially heading downwards, and not many interventions, or perhaps only one intervention, might be needed to actually bring that child marriage rate down to the 5% by 2030. So the way the model works is it just selects one or more interventions that will achieve that rate of child marriage by 2030 and doesn't select any more, thereby minimizing the cost. Now, the way it runs, you simply choose the country. For example, we might go to Laos, and we might choose the rural area. And then once and as I said, these figures automatically update, but they can be overridden by, you can put in your own values if you have better information, because all these values are from studies from some countries we have attributed to the different countries that we're looking at. But they can be, the costs and also the effectiveness of each of the interventions can be manually entered. So once you've selected the country, the area, the target marriage rate, child marriage rate by 2030, the start and full year, they're automatically filled in at those rates of 5%, start year 2020, implementation, full implementation year 2030. Once you've got all those results, you simply click on the solve optimal interventions. Now, it is a bit slow because it has to crunch a lot of numbers in order to find the optimal intervention. Technically it's a non-linear optimization model, and they do take a little while. So often takes about 30 seconds to find the result. So as you might be able to see at the bottom of the screen, it's just setting up the problem now. So as it does so, it then works out through the various sub-problems and trial solutions. As you might be able to read down the bottom, looking at the objective cell, we're trying to minimize that to achieve the 5%. So as you can see, my computer isn't the fastest computer in the world, but it's not too bad, but it still does take maybe 30 seconds or so to find the solution. As it's doing that, was there anything you wanted to add, Bruce, while I was just waiting for the results to pop up? You're on mute, Bruce.
I guess how many, I guess we could talk about a bit about how many countries are included in the model. Might be useful for people to know.
We've looked at 13 states in India, and in addition to that, approximately 70 other countries. And they are all in the drop-down box listed there. So you just select the relevant country. And again, you can choose whether to look at the whole country or just the urban and rural areas.
Okay.
So hopefully it won't be too much longer before it pops up with the solution.
That's okay. I think we all appreciate the fun of doing live demonstrations. So I think maybe it'd be helpful if you can remind folks of the key decisions that the user has to make. In particular, if they already start knowing which country they're modeling, what are the key items that they have to decide on in order to produce a result? If you can just reiterate that, that would be very helpful. Thank you.
Sure. So the key point, obviously, is selecting the country, pardon me, followed by whether it's the total country, the urban areas, or the rural areas. In the box in cell J8 there, just popped up with the solution. So once it finds the solution, it automatically pops over to the results. So what this does is list the number of child marriages that have been averted by 2030. The ones which would have occurred if the baseline had stayed as it was, and how many were still occurring, that 5%. It lists which interventions are included. You can see here that rural schools are included, but improved school structure is not. So in this particular case, it's not, the model has not selected that intervention because that hasn't been the most cost-effective approach. But the other ones have been selected. So it does give you these ones are the education interventions, and a total of those per year, and also the community interventions, the child marriage, the total cost there. Now, as we go across, it gives you the yearly figures, and it does project them out to 2050. And it also gives you a net present value cost for 2020 to 2030 listed here, which is split up into education costs, community intervention costs, and also specifically just looking at the cost in 2030, how much that would be undiscounted. We would expect the dotted green line, we would expect the child marriages to remain at that level. With the interventions, we see that the child marriages drop down to the 2030 below 5%. And the costs here are listed as the costs are ramped up. So that reflects the increasing rate of interventions and also the population. So that shows the complex interaction of those two, shows you the costs for each year as it goes along. Was there anything else you wanted to add, Bruce? You're on mute again, Bruce.
Sorry, I can see questions coming through, so that's good, and we can pick that up in Q&A, but I think that's enough for the moment. Howard, is that okay?
I think that's terrific. And as you said, there are lots of questions coming in the Q&A, and also we're getting responses in the Q&A as well. So a lot of people asking about how can they learn more about the details of the tools. What exactly do you mean by, let's say, specific definitions? And so the toolkit has that information, and of course there are model notes as well. So there are sources for that. And it's actually a very convenient question because it actually transitions us very conveniently over to Nadia. And Nadia will be able to discuss a little bit about the online tool, as well as how it connects with some of the publications that we've already had produced so far. So just to In brief, I want to first of all thank Nadia for her leadership and work throughout this process. She's a senior associate at Avenir Health with close to 15 years of international health technology and programmatic experience. Nadia Carvalho has worked in HIV/AIDS, reproductive, and maternal health. In this particular area, she's been instrumental in driving the development of the written toolkit as well as supporting the online tool development. So I think you're going to give us a little bit of an overview. I'll pass it over to Nadia. Thank you.
Thank you, Howard. So I've just shared my screen, and you can see that this is the toolkit that we've developed to help you to develop your own investment case for achieving the transformative results. This toolkit is available in the resource section. You just click on the link and it'll bring up the latest version of the toolkit. So this toolkit is really a step-to-step guide.
Nadia, can I ask you to perhaps go a little bit closer to the mic and speak a little louder? Thank you.
Yeah, sorry, is this better?
The louder you do, the better for me.
Okay.
Thank you.
So this tool is really a step-to-step guide that will help countries to prepare for their investment case. It has multiple chapters, so it provides you with a guide for how to prepare, some documentation, and then how to plan for your investment case. So it helps you to develop some concept notes, to identify the resources that you might have available. And then there's also a very detailed costing chapter. And this chapter walks you through, depending on which transformative result you are working on, it'll help you to estimate the costs using the tools that we just discussed, as well as some other tools that are available online and through downloads. The tool will also help you to think about the scenarios for your investment case. It'll help you to frame the investment angle and to write up your investment case. And it'll also help you to use this investment case for advocacy purposes. And then finally, to monitor and evaluate the progress that the country is making towards achievement of the transformative results. There are a lot of appendices in here, so you have a lot of options that you can tailor for your respective country. And this, again, it's being piloted right now, so you might notice some comments in the box, but we will continue to update it. But we hope that it'll be a great resource for you as you move forward. That's it from my side, Howard.
Okay, thank you very much. And Nadia, I think what you framed up some of the content that already exists, which I think is very helpful. Since I have you on, I would love to just maybe recast some of the questions that came through that really are about tool maintenance. So if you don't mind, I think maybe if you can discuss a little bit about the maintenance of the data itself. So how is that information going to be maintained, let's say, over the next year or two? Also, how do people access the data sets themselves? What's the best way for them to approach that? And then lastly, it looks like the tool is in English. Is there any plans for it to have perhaps a French or Spanish version? So over to you on some of those questions about maintaining the data, accessing the data, and the language of the toolkit itself. Thank you.
Okay. Yeah, thank you, Howard. So the first question about the data. So with the online versions that were demonstrated earlier today, that coverage data is automatically updated on a regular basis because it's linked with the data that is in the Spectrum. And any user that is downloading Spectrum and using FamPlan or the LiveSave tool, that data will automatically be updated. The data in the spreadsheets, that's a little bit trickier. If you are questioning some of the data, then you can reach out via the help page, and we can try to answer those questions. The next question was about how to access some of the projections, I believe. As we've noted in the toolkit, there are baseline projections available for each of the countries included in the transformative results costing journal. And we've mentioned in the toolkit that if you did want to access these baseline projections for maternal health, then you can contact us via the help page. And we will give you access to those projections, which are available for the LiveSave tool, and particularly might be useful for you as you use list costing. And then the third question was about language. At this point, everything is available in English, and we don't have plans to do any translation. However, as John mentioned, there are many user manuals that are available online for the LiveSave tool, for Spectrum, FamPlan, and these have already been translated into different languages. So you might want to try to check online to see if these translations already occur.
So thank you, that was most helpful. And just to hit the highlights on this, so some of these tools are building on tools that have existed for decades. So when we refer to FamPlan or List and underneath it, the DemProj tool, these online versions are building on desktop versions. And that allows you not only to look at the data underneath very easily, but also we have not just the translated versions of the manuals, but also you probably have a lot of subject matter experts in your countries and regions who are very familiar with these tools. Some of the Excel-based tools are somewhat new, the FGM tool, the child marriage tool, for example, and the gender-based violence tool. And as a result there, it's more dependent on looking at the manuals themselves. So in terms of moving on to some of the question and answer, what I'd like to do is maybe open up with what is a question that, two questions that I have seen presented in a few different areas. One of them is specifically talking about the interlinkages between the different tools and perhaps reflecting on that. And I'd like to open that up as the first question. And then I have another, looks like top question, but maybe we can ask the researchers to talk a little bit about interlinkages, and perhaps we can start with you, Dr. Zhao, and then maybe pass it over to Avenir Health.
Great. So I did see that question. The question, and I'll restate it for folks if it's tough to scroll up and back. The question was whether or not there are linkages between a reduction in unmet need for family planning and the consequences for maternal mortality. So the answer is yes, but no. So this functionality is available within Spectrum. When this tool for UNFPA was developed, it was sort of modular. So right now, for example, we have unmet need relating to those outcomes, and it does have maternal health there. But when you go to the maternal ending preventable maternal deaths, you don't see, for example, changing contraceptive prevalence as a intervention, whereas the full, we have a list module online, which includes, for example, all maternal newborn child health interventions. So, you know, you'll see all the immunizations, ORS, et cetera, that it does show up there as a reduction in CPR. So the way that it's linked in UNFPA, this Impact40 is a little bit different, but there are some linkages in place. We've talked about next rounds and whether or not at some point it would be this sort of master model where, for example, changes in child marriage or the prevalence in child marriage may change outcomes for maternal mortality, but things like that are pretty advanced, and we don't have the sort of available data to have mapped out those pathways. There was one question about data, and I think Howard or Nadia had answered it, and I just wanted to mention that for those maternal interventions, those are all updated from the LiveSave tool database that feeds into Spectrum. We collaborate with Countdown to 2030, and so Cesar Victoria's group is analyzing all of those indicators in sort of a standardized way. So again, that is also certainly subject to change. So as soon as you open that dashboard and select the country, you can update if if there's in-country information or there's a more recent survey than, for example, the last EHS or mixed. But we do, the LiveSafe tool database does update those every call it 5-year intervals for those population-based surveys.
Okay, thank you very much. And John, I'm wondering if you want to either elaborate more on this question of the interlinkages, or perhaps maybe shed some light on questions about the relationship between the One Health tool and the Impact and Spectrum tools. So perhaps if you can add some information on that.
Sure. So just to say that in the linkages, within the software, the list module, which does the maternal and child health, the family planning module, and the demographic module are all linked. So all those calculations all feed off each other. We have not yet been able to link in the gender-based violence and child marriage and female genital mutilation, but the child marriage and the child survival and family planning and demography are all linked. The One Health tool is designed to look at the health system impacts of achieving your goals for the transformative results. So it's designed to look at personnel, different types that you need, facilities, human resources, et cetera. So they're really all part of the same tools. So One Health shows you the health system impacts of achieving the transformative results in maternal and child health, family planning, et cetera. So they are all linked together in the same tool.
Great, thank you very much. And just on the theme of these broader questions that are coming up, because we will get into more detailed ones, and I'm going to go basically module by module. There's a general question about how do countries think about incorporating the impact of COVID-19 or any other major disruption into the modeling itself. So as they're systematically thinking about applying this, knowing where we are today. And so maybe it's useful, we'll start by asking, perhaps Victoria, can you start? And then we'll go from Victoria to John, Rachel, over to the Victoria University team, and just walk through each one's impression of how would you modify the assumptions based on COVID. And I should note that the researchers have just produced an analysis on this that is all over the news today. So we have subject matter experts on. So first, Dr. Zhao, over to you.
So this work had started prior to sort of obviously the pandemic, and so what we had demoed today, the current this UNFPA Impact40 does not have the ability to run. In other words, what we're looking at is scale up of interventions. Scaling up those interventions would reduce the number of maternal deaths we would hope to observe or record. And the flip side of that is that with the LiveSafe tool and its associated modules within Spectrum, with declines in coverage, you would see a concurrent uptick in the number of deaths. And so the analysis that Howard is mentioning was one that our group had just run, looking at 118 low and middle income countries, and if what would the indirect effects be of the coronavirus pandemic related to disruption of services, routine services. So key, in this case, key maternal interventions that would be being delivered that can no longer be provided either because the health system lacks the resources, supply chains are disrupted, or the healthcare workforce, for example, is barely able, or the health system basically collapses. So there is the ability to model indirect effects. For us, our goal was to estimate progress or steady gains to achieve a goal. In the online version, the desktop version, you can run reductions in coverage to look at increases in mortality. So for us, that capability exists, but sort of beyond the scope of this current tool. And so the other idea somebody had mentioned, how would you, one of the questions was how would we account for access or utilization related to changes in coverage. For example, how would we, hold on one second, I just wanted to find, it was related to maternal interventions. And for us, we are sort of looking at coverage as the final lever or influence that would lead to impact on mortality. So we're sort of assuming that, yes, if access, if we're not able to expand access aggressively, which is what our initial plan was that we were going to be either opening clinics or improving emergency obstetric services. We're no longer able to do that either as aggressively or modified a more conservative projection due to limited resources, then that would be what you would enter for the coverage of those key interventions. So that would be from the maternal health perspective. So over.
Thank you. And
more questions.
So the tool really being to dial up and adjust where the coverage assumptions are, and perhaps the unit cost assumptions getting adjusted as well. John Stover, over to you. Maybe you can discuss a little bit about family planning as well as gender-based violence and how those adjustments might be played for the COVID situation. Thank you.
Sure, thanks, Howard. So we have been looking at that and actually coordinating with Hopkins on generating assumptions so that countries can run their own scenarios around COVID. So for family planning, it's a little bit different because the whatever assumptions we make about service disruption will affect differently couples depending on the method they use. So sterilization, for example, or IUDs, sterilizations will not be impacted. Long-term methods would have only a minimal impact. So the larger impact might be on short-term methods. But then there's a variety of approaches that countries are using to try to mitigate those efforts. So we are working to develop a sort of a set of recommended assumptions about the impact of COVID that can be included in the analysis run with the desktop version of the model. They don't work on the web version here because we don't have the annual series of coverages. And then for gender-based violence, we're looking at two ways that COVID could affect gender-based violence. One is that by diversion of resources to address the pandemic, it will slow down the scale up of our progress towards reaching 2030. So we've been looking at, what happens if the scale up gets started like 2 years late, delayed 2 years because resources are devoted to the pandemic. And then the second one is an increase in violence in 2020 as a result of stay-at-home measures. We have anecdotal evidence of this. We don't have surveys or really good quantitative evidence yet, but we've been estimating that perhaps somewhere on the order of 20% additional cases of gender-based violence might happen in 2020, and then hopefully it goes back to some quote-unquote normal level after 2020. Thanks.
Thank you, John. And in fact, we're starting to see data come in now about the increases in gender-based violence in certain areas. So the more we can understand what's going on, the better we can model it. Rachel, do you mind talking a little bit about FGM and how some of that modeling might work in terms of accounting for COVID?
Sure, thank you. Much like the gender-based violence analysis, we assume that the programs could not start until a later date or would be pushed back in their expansion. And that's in part due to the character of what some of the most proven programs are in combating FGM, things like community empowerment programs, public declarations of abandonment, which by definition are group events. So for the purposes of modeling, we assumed that they would be pushed back in parallel with the GBV programming by about 2 years. Our original analysis suggests that the FGM prevention programs would avert around 5 million cases between 2020 and 2030 in the 31 countries that we analyzed. However, delaying the scale up of prevention programs by 2 years would reduce that progress by 33% in our estimates. So an additional 2 million cases of FGM. At the same time, as we learn more, we hope that there'll be a movement towards perhaps more social media programming or other things that may be able to, in some ways, fill the gap that would have been done by the more group programming, the community empowerment and
public declarations of abandonment. And as we get more information about that, we'll probably revise our estimates and start to develop more nuance around what might fill the gap.
Great, thank you. And Bruce and John over in Australia?
Maybe I can start. So we thought there would be two effects. Of course, it's very early days in terms of assessing what impact COVID is going to have on things like child marriage. But we did consider two impacts. The first, which others have already talked about, which is delays in the implementation of the interventions. And I guess from the kinds of interventions that we're considering, we thought about a year was reasonable. And so we pushed back the model by 1 year. The second was I think perhaps even more important one, but harder to model. And that was the economic impact of COVID on child marriage. And that's a sort of a multi-step process. First of all, what is the likely effect of COVID, particularly through low-income countries where child marriage is most prevalent? And secondly, if there is a reduction in economic activity, what effect does that do in terms of flowing through to child marriage? And in the first instance, of course, we know that child marriage is closely related to increase in poverty. So what is the likely increase in poverty? And we did a bit of a literature search, I guess, to see what the literature said about those various linkages. And we started with some early work on the economic impact on poverty of the COVID-19. And we did some work done looking at a range of scenarios from 5% reduction in GDP per capita to 10% reduction in GDP per capita, so sorry, 20%. And we took the middle one, which is 10%. So we worked with a reduction in GDP per capita of 20%, 10%, and we stepped that through to the impact on child marriage rates, which was about, from the data we had, about 1.5%. And so those two effects result in an increase in child marriages of about 12 million over the period to 2030. So it's a fairly substantial increase. We're modeling a reduction in child marriages of about 60 million averted over the period to 2030. So 12% is a fair proportion of that. So I think it reflects that the COVID is going to have a reasonably serious impact on things like child marriage. Thanks, Howard.
Thank you. I appreciate that. It's most helpful. And I should say that please continue to send those questions in, and we're going to address them. What I'd like to do is go through some of the subject-specific questions, ones that perhaps aren't completely cross-cutting, but at the same time, people have identified it. One thing to also note is your questions and answered, we're tracking them now. They'll all be part of the Q&A that will appear online. So maybe starting with the family planning, there was a couple of questions that I would love it if John perhaps could discuss. One of them is specifically asking about the cost that's being estimated. Does it include elements such as capacity building, advocacy, or is it really just focused on the commodities itself? So one question about the costs. And then another question I would love John Stover to respond to is really about the utilization. Some of these tools have been used for many, many years. And a question that was raised was how to help with the acceptance of these results. As people hear the analysis, how to build confidence in it. So a science question and perhaps a communication question over to John Stover.
Thanks, Howard. So the first question is the easy one to answer. Yeah, our cost estimates for family planning are comprehensive. They include everything. So it's commodities, it's service delivery, it's facilities, training, research, capacity building, advocacy, et cetera. And these are derived by looking at expenditure on family planning in each country from all sources, from donors, from national governments, from out of pocket, and then relating that to the number of modern method users to try to estimate a cost per modern method user. So these are complete estimates of the total cost. Utilization. So this tool that we're showing you today is something that's designed to allow you to get a quick estimate of what the costs and the benefits would be of scaling up services to reach these transformative results. And so that's useful for advocacy. If you want to take it the next step, so get into the details, get into planning, et cetera, that's where you need to use the download the desktop tools that allow you to look at all the different assumptions. And what we recommend that you do is that you form a team. So it's not just you doing it in your office, but form a team with folks at the Ministry of Health, Ministry of Finance, Ministry of Social Affairs, wherever, to review jointly the different inputs and assumptions to the models, and then and make sure that everybody on the team understands how the models work. And then it takes a long time sometimes to do these activities, but then you end up with a team of people that have all agreed on the inputs, and they then help sell the results to everybody else. Thanks.
Thank you, John. That's most helpful. And just a point for our UNFPA folks. First thing is that there was a guidance note that was issued in January to help in terms of advising the process that we as an institute recommend for implementing the cost and impact estimation. And along with that, those ideas were incorporated into the toolkit itself. So what John mentioned there in terms of the use of a team, not just of UN and external experts, but heavily engaging ministers of health, minister of finance, is all part of the elements in both the guidance note and the toolkit. So very good resources for folks to take a look at. Also embedded in that is the question about advocacy and how do we get value going beyond doing calculations to really creating impact. There are some guidance already in the toolkit itself, but this is also an area where UNFPA is going to continue to learn from each other. We have countries that have had great success, and we want this to, again, to be a learning process. I'd like to, if I can ask everyone to put themselves on mute unless you're a presenter. All right, thank you. So now I do want to take a question over to Dr. Zhao at Johns Hopkins. So for maternal health, there's a specific question regarding, again, the breadth, all right? So the question is, costing in this case seems to be very service driven. Are there ways to factor in interventions related to barriers to utilization, things associated with strengthening accountability systems, promoting legal change, empowering women? So going beyond the service costing. Any thoughts on that?
So one of the challenges is that for sort of the evolution of our tool, our perspective has been based upon sort of evidence-based interventions. And we totally recognize that delivery of those interventions has to occur and would be optimized within sort of a strengthened health system. So there were two related questions. One, which is I noticed that the impact and costing are going to be very service driven, addressing barriers, for example, to reduce maternal deaths. And then another about sort of how to factor in demand side costing. So for us, we have only recently started to kind of step back the model. In other words, traditionally where we had started was looking at coverage of key interventions, effectiveness from meta-analyses or field trials or something like that of an intervention like, ITNs or ORS that are going to be delivered, and the effectiveness will be the same whether it's in Bangladesh or it's in Ghana or it's in Afghanistan. And the coverage of those is from sort of where we are, I would say downstream, but from where we're focusing the coverage element to the impact on mortality, on cause-specific mortality, we were able to kind of map out and examine. And given what we're calling sort of a shift that's really important for planning to occur upstream, to consider things like barriers to access, demand creation, generating interest in terms of folks seeking services, as well as the really important aspect of quality. So, you know, for all of the initiatives of late that have been driving things like utilization, like, you know, getting folks to deliver, whether it be at a policy level or incentivizing health facility deliveries, for example, working in collaboration with colleagues who are studying really carefully quality of care and determining that, you know, even as we're watching those numbers go up for how many women are now delivering in a health facility, in a lot of these facilities that are not providing high quality care, we're not seeing reductions in maternal and neonatal mortality, and sort of unpacking that and trying to understand. It's kind of one of those Russian dolls where you open one and inside there's another smaller one, and you open up and there's another smaller one. So we clearly acknowledge and recognize that there are components upstream, whether that be a favorable policy environment, whether that be you know, political will, motivation, or even at the household level, individual level, sort of recognition of patient awareness of danger signs or things like that. Unfortunately for us, we haven't mapped them out to have all of those factors or parameters quantified. And so one of my colleagues, you know, we collaborate a lot within the institution, and we have other colleagues that are working on measures to improve quality, tracking of quality or improvements in quality through things like SPAs and SARAs and health facility assessments, to say, okay, am I improving quality over time, or am I improving utilization, or am I improving both? In which case I anticipate that if I'm doing both, what we're calling sort of effective coverage, we've always just called it coverage, and it really is what folks refer to as effective coverage, which is delivery of high quality interventions to populations in need at the time that they need them. So these are all clearly things that are on our radar and we've acknowledged, but it's not currently incorporated by default. And so the way that folks have done it is, again, by modifying or by adjusting the ultimate coverage trend. So our approach for coverage for each intervention is kind of very an approximation of 0 to 100, right? 100% means everybody who needs it is getting it. 0 means no one is. And where am I starting with a baseline level, and then where would I be able to strategically position myself, advance either by pushing, again, demand side, you know, supplies, et cetera, to advance, improve that coverage. So we definitely acknowledge that this is sort of one of the limitations. We don't have an additional screen as of yet that you can sort of click and it unpacks it. On the desktop and on the online version for maternal health interventions, we have it broken out into 2 simple factors, which is one is utilization and one is quality. And we certainly know that to drive each one of those is a whole nother cascade of factors upstream. So it's point well taken, and it definitely is stuff that we're working on. So thank you.
Thank you very much. I appreciate the detailed reply, and truly that's some of the more difficult parts of the modeling itself. I have one question for Rachel Sanders on FGM, and in particular, I think there's a clear understanding that the tool looks at community level interventions, but could you perhaps provide a little more information about any of the interventions related to the health complications of FGM? Is that included? If so, what particular elements are included?
Sure. So we've included 2 components in the cost part of the analysis that look at health complications of FGM, and that includes training for providers and attention from the psychosocial support perspective at the time of a first birth. So this is a quite conservative estimate. We know that based on the WHO analysis that was published in the bulletin, that there are additional needs around the time of birth just due to health complications of the mother. And we also know that there may be psychosocial support needs beyond the just the time of the first birth. However, these are the programs, when we came down to kind of a comprehensive and narrow definition of a program, that's what we looked at, was provider training and psychosocial support at the time of the first birth. If countries want to expand beyond that, then we can talk you through how adding that might work. Thanks for the question.
Great, thank you very much. For our friends in Australia, John and Bruce, we do have a bunch of questions, and I'm going to lay out a few of them and let you choose which ones you want to tackle. A few are related to this optimization and understanding the process behind that. Perhaps maybe a brief explanation of that would be great without causing any flashbacks to people failing nonlinear systems back in graduate school, me. So if you can talk about that, that would be wonderful. Also, if you can maybe talk a little bit more about the inclusion. What countries are already included in the tool, just so people can understand whether it might be most applicable for their country or not. So some of the logic behind what was in and what was not in would be most helpful. So pass that over to you guys for your responses. Thank you.
I'll pass the optimization problem to John, being the expert in that area.
Thanks, Bruce. So the optimization just refers to what is an optimal result in terms of trying to achieve a particular goal for either, for in this case, for a minimal cost. So I saw some people questioning what are optimal interventions. So it's not a case of interventions being optimal as such. It's a result, an optimal result in terms of trying to achieve the goal that you were trying to achieve, in this case for our model, child marriage of below 5% by 2030 for a minimal cost. So that solution is the optimal solution for that particular set of constraints. So given that the interventions that we've selected were based on literature reviews about, and where we had certain good evidence base for their effectiveness, and that we included those ones. There are other ones, but these are the ones we felt the evidence base was strongest for. So we included those, and what the model does is sets up the problem to achieve that 5% child marriage rate, and achieve that rate by selecting interventions that cost the least amount of money to do so. So hopefully that makes some degree of sense.
Perfect. And Bruce, over to you on the scope of the countries.
Yeah, on inclusion, they're really a product of where we have data. So as I guess most of you know, data on child marriage is relatively spotty. It's essentially collected from household surveys, and they're done by countries somewhat sporadically. So what we look, and we were seeking was to get some historical view on marriage rates over time from about 1990 through to now. And it was the countries that had what we thought was reasonably reliable data, which were included in the model. So it doesn't kind of stop, I suppose, the model being used by other countries if we insert certain marriage rates. But the way the model was constructed is very dependent on those countries with perhaps at least 3 or 4 data points over that period.
Thank you very much. More broadly about the models themselves, so child marriage is intended for countries which have comparably high levels of child marriage. The FGM models are built really for countries that have substantial FGM cases in terms of incidence and prevalence, as well as having known data. Whereas the other models really reflect the breadth of low and middle income countries. So that gives a little sense for the logic behind it. It's really to map to where the countries have the expected most needs. With that, I'm going to wrap up the question and answer session and pass it over to Taranga, who can talk a little bit more about some of the next steps. So thank you very much, and over to you, Taranga.
Thank you, Howard. Let me just share my screen. I hope you can see the screen.
Yep, perfect.
Great. So thank you, Howard. Thank you, colleague, and thank you all the presenters for having, this very rich full discussion today. So as Howard said, I would just like to discuss some of the next steps in the process, because we saw around 225 colleagues or connections. So, first of all, I would like to just concentrate about utilization of this, because that's the most important. So how we utilize of this tool effectively in programming. So the first thing I just want to tell you, I'm sure this transformative results costing publication toolkit and tool. So I'm sure these words came throughout the discussion. I don't know everyone is very much familiar about what is this. So I think since we are releasing more guidance, more tool, I think it's better to have a very the holistic understanding. So we released the first publication of costing of transformative results. Then we have a toolkit of how to develop investment cases. Now we have tool. So I want everyone to have a clear understanding what are these components. Otherwise, it might be a little bit confusing what is each of these pieces doing. So in terms of utilization, we want each and every country office to utilize this and provide your comments as much as possible for us to improve the tool, and on the other hand, accelerate the achievement of the transformative. In terms of utilization, I would like to look at these two angles or two sections. One is about how all program countries, all UNFPA 156 countries utilize in this tool. If you are willing to utilize, what are the areas we can utilize this tool? Now remember, this, you might feel like this is about costing. I'm not doing any costing. I understand not all countries doing costing or developing investment cases at the same time. But that doesn't mean that you cannot use, you can use the tool. But that's why I just want to highlight this first section. What are how we can use the tool, not really developing investment cases, but what are the other areas I can use the tool in order to prioritize transformative results at the National Policy Assistance Program, on the other side, accelerate the achievement of the transformative. First one, as a planning results. When you are doing country program documents, remember we have to include outcome level indicators. We have to include output level indicators. And most of the problem we are facing right now is we don't know how to set the targets for those indicators. Because since there's no way of anticipating the impact for next 5 year my country program, next 7 year my national development plan. So what we can use this tool in addition to developing costs just for our resource planning purpose. So we really want you to keep that in mind. So that is the place where all countries can utilize in terms of your resource plan. And the second one, so we, as you know, UNFP is moving towards higher level resource. We have you must have seen the recent guidance, recommendations, and policies. We encourage all of you to think high level results. That doesn't mean we should not prioritize our output level or interventions. That's absolutely needed. But if your high level results are not moving, we need to plan, we need to really manage that. We call it management for development results. So this tool will help you to promote you some sort of a background to plan your higher level results. So that's the other component, other angle we can use this Impact40 tool. And then the third one, as you know, we all are in the cooperation framework, joint planning, joint monitoring, joint reporting, right? So we all in that context. So this could be a good opportunity to work with other United Nations organizations or other partners, especially with the government, joint planning. So take this tool as an opportunity or tool to go with joint planning, because that's one of the UN reform things. We should move to the joint planning. So these are common results. These are not UNFPA results. So this will really help you to do that. That's my third point. And we discussed about the COVID. The tool has a potential to use for COVID impact estimation. So, and there will be a webinar next week. We are planning, hopefully, to communicate you COVID impact. Howard mentioned it's all in the media today about UNFPA impact estimates already gone. And so we saw the Guardian front page and all the places. So we are going to have a webinar to you explain more methodology behind it. And if you want to use the same impact estimate for COVID, you may be able to, you use that too. So that's and the fourth one is the reporting. You all know there's a big problem of reporting of impact level research, especially maternal death averted, unintended pregnancies averted. So we have these indicators in our strategy plan. These are very much commodity driven. So now we have a broader coverage and more broader intervention driven model. So we encourage you to try reporting your impact to us, impact to donors, using this model. So these 1, 2, 3, 4, 5 elements are really important for all countries to utilize this. So again, we don't want only limited countries using it. We want each and everyone at least one try to use this tool. And of course, there's a certain cluster of countries. I know we have around 25 countries who already committed to do the investment cases in 2020 towards transformative research. Of course, this is the tool. You can use it, but that doesn't mean you cannot use other tools or other models. Still you can use, because there was a question on that. But try to use this tool and just give us your opinion, because we are thinking about sharing the knowledge. How do you utilize this tool with other country officers? So that would really encourage us to have a more improved tool at the end of the year. So this is in terms of conclusion, I would like to bring you this attention. This is for everyone. This is not just for people who are just doing costing or no, it's because this has a huge impact component. There's a huge potential to use that for that. And the other thing I just want to mention about the resource mobilization, try to use the tool for resource mobilization purpose. I think it has a huge potential to get the resources, because we know at the corporate level, donors love this impact level results and the cost estimate. So try to use it. And if you have any challenges, please do let us know. And one last couple of points before closing, because there were some questions about what you call about translation, and Howard already answers, but we are thinking about translating, since there was a couple of questions. Hopefully end of this year, once we have the final, close to final version, that's also in the thinking. And I can see the need of developing a manual around it. I know we have a very brief user guide, and we have papers, maybe, because I saw there are some colleagues asking about metadata for interventions. What are the assumptions on intervention? So I can see a need of having comprehensive or maybe updating toolkit and link into toolkit, or having a comprehensive piece which can help you. And there will be more videos and some sort of visual elements aid also coming to better understand tool, because some countries might think it's a little bit complicated for them. So, but we will try our best to provide relevant tools. And then there's another plan. You see some of the tools are, some of the models are in Excel based. I know it might be not everyone is comfortable on that. And so we have a plan, not sure whether we can make it 100% this year, to bring some of these Excel tools to the system. So then you don't like a list serve, you see everything impact and cost on the same, so you don't need to download Excel. This is just an idea. I hope we can make it also. And those are some of the last minute things. Let me, before closing, there are 25 countries already expressed their interest to develop investment cases. So they are the first one to utilize this tool. So we'll be having meetings bilaterally through the regional focal points, and to guide you how to use this tool, and then do the national investment cases to prioritize transformative results. So there are some other last requests. We want you to provide your comments as much as possible and try to utilize. I mean, without utilization, it's not, so we always encourage you to utilize as much as possible, and provide comments to improve the tool and develop investment case. If others also wants to develop national investment case, please do let us know. And we are thinking about launching this tool to public in 2021 as a comprehensive tool. Then our implementing partners also can use, not only UNFPA. So we have around 10,000 partners. So they're also waiting to use this tool. So anyone can use by 2021. And and on the last point is, I want you to really take and promote this tool as a UNFPA and with the tool. And because I can see there's empowerment. It has a huge empowerment, especially for civil society organization. We know a lot of civil society organizations working with us at the country level. So it would be a good opportunity to empower them on the impact estimation, cost estimation. So take that opportunity, and I'm sure that's going to be a very good learning opportunity for all. So that's all. At the end, last thing, there's an email address, impact40@unfpa.org. So you can send all your comments to us. And so we are trying our best to reply to you in collaboration with our the scientist who is present. So maybe with that, so we can, Howard, is there any other thing? I think we can close the session. Do you think, did I miss anything?
No, I think you did great. One thing that I see a lot of emails of people indicating their countries are interested in. So there was a call for interest. I believe it might have come from PSD. And so just look through those emails, make sure that you respond to that, as well as navigate through your regional offices. Taranga, myself, and others will be working with the regional offices in coordinating the technical support, as well as, I think for some countries, even some financial support. So as you express that interest, make sure you funnel that through the official channels, regional offices, as well as the response to PSD's call for support. But maybe I'll pass it over to you, Taranga, for the final word. Thank you.
Yeah, thank you so much, Howard. And that's good that you mentioned about regional focal points. Colleagues, there are regional focal points, so we will let you know over the time, but we have that support also. So with that note, I think I would like to, Charles, are you there? I'm not sure whether Charles is around. Maybe not. So I would like to thank all the presenters and the excellent presentations and all the colleagues. I mean, all your questions. And so as Howard said, we are trying to post all that questions in our Q&A section in the tool. Then you see the answers. And Nadia is helping on that. And at the end, I would like to thank Howard and Janet and all the colleagues in UNFPA who helped me and us on this process. So with that note, so we close this session. Thank you so much.